Welcome to Mental Matters, where we explore the many dimensions of health and well being in today's changing world. In this episode, we turn our attention to growing concern the mental health of our youth and adolescents, shaped not only by social media overuse but also by the careless use of mental health language in everyday conversations. As social media becomes a constant companion in young lives, it offers both the connection and confusion between the scrolling and pressure of comparison and the casual misuse of sensitive terms like anxiety or depression. Many children and adolescents are left struggling to understand their own emotions. Today, we ask how is social media shaping their mental well being, and how we, as parents, teachers, friends, and as a society, respond with responsibility, awareness, and empathy. Dr. Garima Srivastava PhD, a psychotherapist trained in trauma focused psychodynamic orientations and couple and family therapy. She identifies herself as a feminist queer affirmative therapist who works with adolescent adult individuals, couples, and families with a degree in clinical psychology from All India Institute of Medical Sciences. She has worked in hospital settings AAMC Dr. RML Hospital, New Delhi, as a psychologist and has an overall clinical experience of over 15 years, having taught as an assistant professor of psychology in Delhi University for 5 years at Lady Shri Ram College of Women, Daulat Ram College, Aryabhatta College from 2016 to 2021. Her areas of interest are history and development of psychology, counseling, health, and community psychology. We are tackling a topic that's on every parent's mind, the intersection of social media and mental health. With so much information available online, many young people are turning to platforms like Instagram for answers about the mental well being. But this is a good thing, or are we wading the dangerous territory? Let's find out. To help us navigate this, we have a distinguished guest, Dr. Garima Srivastava PhD in clinical psychology from the prestigious AIMS Institute and practicing as a therapist with over 15 years of experience, specializing in adult, family, and child therapy. Dr. Srivastava, thank you for joining us.
Thank you for having me. This is a very crucial conversation, and I'm really glad that we are having it today.
Let's dive right into it. We are seeing an alarming trend where young people are using their social media to self diagnose mental health conditions. They're watching short videos, latching into psychological terms they are hearing, such as ADHD, anxiety, OCD, and trauma. What is your professional take on this, Dr. Garima?
It's a significant concern, Purva, because while Instagram and social media platforms help raise some awareness and reduce stigma, it cannot be a substitute for a formal mental health diagnosis. When we go to a mental health professional, they use their expertise and knowledge, they look at your past history, they look at your current turbulent conditions, and they make a global diagnosis. Whereas when we just look at social media and we start labeling ourselves, it does more harm than good. It also trivializes the real pain of people who are going through psychological distress and psychiatric disorders. So while someone can experience some of these symptoms, it may not be a psychological disorder per se.
So this is very concerning. What you mean is that if a teenager is feeling restless and they read something which makes them understand the terminologies about ADHD, they might start self-diagnosing and thinking in their mind that they actually have the condition. That's very worrying, Garima.
Exactly. In psychology, we use two terms. One is self fulfilling prophecy, and the other is confirmation bias. So, this could mean that because I'm reading so much information about ADHD, I will begin to believe certain aspects in my behavior that match that condition, or at the same time, I will start probably behaving in certain ways that fulfill this pre-existing condition or this belief of mine. So this is how the social media traps young minds. The second thing I would like to say is that when they are self diagnosing, they are in that process probably not getting help for what the real issue is. So, for example, a child who might feel, or an adolescent who might feel that I have generalized anxiety disorder, maybe just has exam related pressure and needs some guidance and counseling on how to deal with that pressure, whereas they move in a completely different direction and they start feeling that they have a disorder.
And Dr. Garima, what about kids latching on to terminologies like I am so OCD or I am a survivor of trauma? What do you have to say about that? Please guide us.
So, Purva, I believe that trauma or any kind of psychological distress is very subjective, and anyone can have that experience. But the problem with loosely using these labels is that it then trivializes the experience of people who actually have these conditions. For example, if a person is very neat and they say, I have OCD just because I'm neat, it's actually taking away from the psychological distress and the debilitating condition that a real OCD person has. They have intrusive, obsessive thoughts and they have compulsions that they can't resist. And they have so much distress that they are not able to live a normal, functioning life. The other thing that I want to say is that the word trauma, again, there are all kinds of traumas, and we're not saying whose trauma is big or small, but real trauma is a psychological injury and that impacts all aspects of someone's life. So, again, when we are using these words lightly, sometimes people who are in dire need for attention, for mental health care, they are the ones who get missed in the process. So, it's very important to understand the difference between a diagnosis and having an experience.
This is very serious, Dr. Garima. It sounds like it's not just an issue of misdiagnosis but also of misinformation.
It most absolutely is worrying because most of these social media accounts, you'll be surprised to know, are not even run by mental health professionals. It's just, normal people who are putting out unscientific anecdotal information, which is okay. I mean, everyone has a right to put out information, but they are sensationalizing it for views and they are misdirecting a lot of these young people who don't have the psychoeducation to know the difference between what to believe and what not to believe. So it's very, very important for us to also talk to our kids and tell them what are the trusted sources of mental health care information. And also, we need to remember that there is no regulatory body that is regulating these accounts of social media.
Now we come to our next segment, which is called Social Media Myth versus Clinical Reality. So there are a lot of very dangerous and viral issues which are going about. And before we go to the audience questions, I want you to address some of them, Dr. Garima. And this segment is called Myth versus Reality. Let's find out. I'll give you the social media claim and you will let us know and clarify what is the clinical reality about it. Great. So let's start with ADHD, attention deficit hyperactivity disorder.
Right.
So the myth that we get to see online is that if you can focus intensely on a hobby that you love, like video games or drawing, you don't have ADHD. What do you have to say about that, Garima?
That's actually a classic misconception of ADHD. Having intentional focus on enjoyable tasks, known as hyperfocus, is actually a very classic symptom of ADHD. So, someone who has ADHD doesn't mean that they have an inability to have attention on tasks. It's actually the lack of regulation or consistency. So I can pay attention, but I cannot hold my attention. Or if I have to shift my attention from one thing to the other, there's going to be a lot of fluctuation. So that is what is ADHD.
That's crucial. Next, we come up with anxiety, which we hear about a lot these days. If you feel anxious before a major event like a presentation or a date, you definitely have a generalized anxiety disorder or GAD. Is that true?
That's another myth. And I think myths around anxiety are the most common because anxiety is a very normal response of the human body and the brain to alert us towards anything that can feel unsafe or threatening. So, on a day to day basis, we will have situational anxiety, we will have anxiety before exams, but to call it generalized anxiety disorder would be a completely different matter altogether because GAD is actually about free floating anxiety, which means that a person all day long is preoccupied with one thing or the other to an extent that they're not able to perform their daily chores, they're not able to have good relationships. So you can see that there is a lot of difference between having occasional appropriate anxiety to that situation and GAD.
Finally, we come to OCD, obsessive compulsive disorder. The viral myth is that OCD means that you are neat, tidy, and a little bit of a perfectionist. What do you have to say about that, Dr. Garima?
OCD is a very debilitating clinical condition. It really torments the mind of a person who's suffering from it. So basically, what happens is that there are some obsessions that a person has or obsessive thoughts they have. These thoughts are very intrusive, very disturbing. You can't get rid of them. And then after that, there are these very strong compulsions to act on something. So I'll give an example. For example, a person has very intrusive thoughts about keeping things clean, or they feel very unhygienic around certain places. The compulsion will be that they will want to clean their room 10 times in a day, or even their office table all through the day. Can you imagine how distressing it is for that person because they cannot control these urges? And these urges that they perform only neutralizes the anxiety for a short period of time. So imagine a person who likes to keep things clean and organized calls themselves an OCD. It is nowhere close to what these debilitating symptoms of OCD actually are.
Uh, Dr. Srivastava, thank you so much for clarifying these myths and differentiating between normal feelings and clinical conditions. This is going to really help our audience identify when they need to see a professional and when they can handle things in a normal way.
My pleasure entirely.
So, what would be your advice for the parents who are watching this show and they are worried about their children going through this?
That's a very good question because parents, I'm sure, can notice that sometimes their children are having some behavioral changes. So, the first step is for the parents to be observant and curious and not judge their children for maybe trying to diagnose themselves, or even if they're shutting themselves away. I think they have to approach them from a point of compassion and curiosity, and maybe ask the child or the teenager that I notice that you've not been yourself lately. What's going on? Can I help you through this? So the point is not to shield them from social media, but help them navigate this space in a way that they know who they can actually go to if they have a problem. So they can come to the parents, they can reach the school counselor, or if there is any other professional. That's one thing. The other thing is that the parents also have to set a good example by talking about their own mental health concerns, right? So studies have shown that where parents talk about their struggles with their children, not to burden them, but just to share that, I had a tough day at work and this is how I coped with it, or I've been feeling very angry these days because of this particular reason. It helps the child normalize and understand that these emotions are natural, and we can all have them. And I also always encourage parents to take therapy, sort out their own issues so that they can help their children better.
We are back on Mind Matters and we have with us Dr. Garima Srivastava, and she's helping us to unpack clinical psychology terms and terminologies which are freely being misused and overused on social media, which is really confusing the new generation, especially as well as the parents. So, with 15 years of experience, she has been talking about the dangers of social media self diagnosis, and now it's time to open up the floor for our audience. Our first question is from a very curious audience member who knows nothing about the issue. So, what's the big deal if a kid thinks they have anxiety? And if it makes them feel better to have a name for it, what's the harm? What do you have to say about that, Dr. Garima?
Thank you, curious member of the audience, for asking this question. Well, the problem with using these terms is that it leads to a wrong diagnosis, and that wrong diagnosis can lead to a lot more harm. For example, if someone is not depressed and they're using the word depression and they're taking it very seriously, not only with their treatment change, they may end up doing some self medication, they may start kind of following advices that they're not supposed to. The second thing is it trivializes the meaning and the weight of the real diagnostic criteria that other people might be feeling. And thirdly, I think it minimizes the actual worry, the actual psychological strain that the person is feeling. So, for example, the person does not have diagnosed depression, but they can be going through grief, or they could be going through some other kind of sadness that shouldn't be overlooked.
It's from a concerned parent. Dr. Srivastava, what are some key signs that my child's social media use might be turning into a mental health problem? And how do I approach them without seeming like I'm attacking them or their phone?
That's a great question to ask, because it's a very common concern now. Some of the signs that parents can watch out for are just general changes in the child's or the adolescent's mood, their routine, and their behavior. These are the three things. Like, for example, if they are suddenly going more quiet, or there's also some increase in their aggression level, if they are keeping to themselves more, like isolating themselves, right? Or also any other unexplained behavioral differences that you can see. At the same time, I would like to say that adolescence is, anyways, a very crucial and a very sensitive time. So, social media might be one of the factors, but apart from that, the parents should also be mindful of what other changes are happening in their child's life. Is there any other concerning stuff that's happening in school or at home? I would also request the parents to, because it's very understandable for parents to show their concern and sometimes they can be a little overbearing. It's very important to approach them with a lot of compassion and a little restraint, because the child is also developing their own identity at this time, and they may completely shut down if we corner them. So I think just approaching them, having an open conversation, trying to be a little friendly with them, and then having a conversation about this.
Okay, our next question is from a child, a 12-year-old. Let's see what she has to ask.
I feel like I get nervous before school tests, and I saw a TikTok that said that's a sign of anxiety. Is it? And if it is, what do I even do about it?
That's a very important question, and thank you for asking it. Anxiety is a very normal response that our body and brain have to a situation that feels threatening. So, before an exam or a test, it's very natural for you to feel anxious. However, if you feel that your anxiety is coming in the way of your everyday life, your sleep, your mood, the way you function, then it would be a good idea to talk to a trusted adult. You can reach out to your parent, the school counselor, because there are so many ways by which they can help you cope better, manage your time better, and also go a little bit deeper and understand your anxiety.
Our next question is from an adolescent. I've been feeling really down, and a friend of mine told me that I should get tested for depression because of a quiz that I saw online. Is that a good idea? Is that even a real test?
Thank you for asking that question, and it's great that you're talking about your feelings. I think that's a very good starting point. However, I would like to caution against online quizzes because, of course, it can give you some information about what depression is, but it's not reliable. It's not a valid test. So, if you feel that you're feeling low for more than 2 weeks, along with other signs like excessive crying, losing interest in things that you were earlier enjoying, sudden mood swings, you should again reach out to a trusted adult or a school counselor or a mental health professional, because it's very important for us to get the right diagnosis so that we can get the right management.
Dr. Garima, the next question comes from a scholar working in this area. From a public health perspective, how can we educate social media companies to be more responsible in curating and moderating content that could be harmful or misleading, particularly in the realm of mental health?
That's a pertinent question. Social media companies need to move beyond the simple moderation of the content that they do. It's also very important for them to partner with mental health professionals that are verified to, curate content that matches the algorithm of the sort of content that the adolescents and young people are looking for. And there should also be verified information at the end that people can understand that this is a true ethical account. So of course these companies have a lot of ethical, I would say, responsibilities that have to be taken seriously, because mental health is a serious concern. And at last, I would like to also say that they also have to make sure that the information is moving from diagnosing yourself to going to the right sources of information.
Thank you so much, Dr. Garima Srivastava, for taking out time and answering these crucial questions for our audience and sharing your expertise. The key takeaway here is for our listeners to be curious but be cautious. Social media can start a conversation, but your health journey needs a professional guidance. Don't diagnose, but it is just a dialogue. If you or someone you know is struggling, please reach out to a trusted professional. You can find the links for our verified resources underneath in our comments. So thank you and keep watching Mind Matters to know more and for your health and well-being.
Thank you so much, Purva, for having me here. It was a great pleasure.